So I got a really good question from Martine from the gym. He was asking about anterior knee pain or just knee pain in general in the front of the knee. So what you're looking at with the front of the knee is you have your patella, which is your kneecap, then you have your quad tendon attaches your big quad muscle to your kneecap, and you also have your patellar tendon, which basically goes from your kneecap down to your shin bone or your tibia there, okay? A lot of times you can get some patellar tendonitis, so some inflammation or irritation in the knee from kneeling, squatting, pushing off. So some easy things are to make sure that you warm up. So get on the recumbent bike or a stationary bike or anything like that, airdyne, for a few minutes to get some good blood flowing. Also some nice stretches. Stretch the hamstring, stretch the quads, stretch the muscles around there to get it kind of loosened up and warmed up. And then also there's another couple things you can do. One thing that I feel like works pretty well is kinesiotaping for the front of the knee, and it's basically called a space correction technique. So an easy way to use the tape has some stretch to it, the kinesiotape does. What you want to do is maybe stretch it about 50 to 75% of its tension, and then put it over the treatment. That's going to be your treatment area. You're going to put it over the painful area. Essentially what that does is it kind of creates a little bit of pressure relief. It kind of gaps the area, creates a little pressure relief, takes some tension off of there, and also some proprioceptive changes, so it kind of gives some changes in feedback, so hopefully it occupies some of those pain receptors, helps with reducing some of the pain. So I know some tape comes in strips. I have one of these longer rolls. They have about 2-inch blocks. So what you have to do is just cut 3 blocks. Your treatment area is going to be the stuff in the middle. Essentially what you do, pretty easy, I like to do a 90-degree bend in the knee. I already have a pre-cut piece of tape. So like a right angle at the knee, if this is my painful area, what I'm going to do is I'm just going to pull in the middle, try not to touch the tape, fold one side over, fold the other side over, and this is my treatment area. So this is 100%, I'm going to pull about 75 to 50%, put it right over the area that's painful, lay that down, and then the ends, I just lay down, trying to get any wrinkles in there, just lay that down, give it a little bit of a rub to kind of help the tape adhere to the skin. So that's one easy thing you can try to do to see if it takes a little bit of tension off. The other thing, there's a bunch of different braces out there. I don't really care about what type of brace. Some fit better than others, some have more custom fits to them. What you're essentially looking for is something that maybe has like a cushioned or gelled area like around the kneecap. What that does, it's going to help distribute some of your weight off of that patellar tendon, off of the anterior knee. So it's going to help distribute some of the weight. Also kind of cushion it, so if you're kneeling, it's going to help soften the blow. It's not going to put as much tension or pressure on the knee. Essentially, I mean, this is just a cheap brace I bought. It doesn't stay on terribly well. They have different braces you can get. You can get fitted, and they're a little bit longer, taller, cover more of the leg, so they can stay better on your leg and they don't slide so much. So essentially, for this one, all you're doing is you basically have your kneecap in the center. And what this does is when you're kneeling, it'll help kind of distribute some of the weight onto the gel, and it won't put so much pressure onto the knees. Some good things to do. Make sure you have a good solid warm up, some nice stretches. You can do the kinesiotaping, you can use the brace, and also ice is great after, if you've done some vigorous activity, you maybe have a little inflammation, some ice is okay to take some of that soreness and swelling out if you do have some of that. Find the formula that works for you. You may not have to do all the things, just find what works. Make sure you do what feels best to you, and if something continues to cause you pain, obviously see your physician or see your medical practitioner, see your therapist, and hope this helps.